So yes, good evening everyone. Good evening Prithviraj, Manjeet, Unaris, Ritika, Jinal, Satvik, Angel, Ashish, Satvik, Jessica, Ovia, Kanupriya, Prashant, Seni. Good evening. I hope the audio and visuals are perfectly fine. You can hear me right. The screen is visible. Ch- Prashant, good evening. Khushi, good evening. Let's start with a very important topic today. That is the upper limb. मेरा एक thumbs up दे दो Lishika, good evening. Nikinder Reddy, good evening. Mutenet, good evening. Just give me a thumbs up in the chat box if the audio visuals are perfectly fine. Akshat, good evening. Toparapu Shravya, good evening. So we are going to start with a very new topic that is the upper limb, right? This upper limb, guys, I will be discussing in several parts. The very first part that I will be discussing up today, it is the osteology of the upper limb. I will be discussing the bones, not only the parts of the bones, but along with the parts, I will be discussing the muscle attachments, the ligaments, the joints, and everything, and applied anatomy also. The same manner, no, in which, like in the book, it is given, right? So let us just start. Yes, Sanjib. Yes, it's the new channel. Like I've been taking classes way back from channel. So yes. So I hope I'm loud, out and clear to everyone. So let's start with the very first topic. That is the region of the upper limb. The regions of the regions of the upper limb. Right. So yeah. Mhm. Okay. Good evening. Good evening, guys. Let's start without wasting much more time. Now, guys, you already know that. Okay. Before I start with the clavicle bone and the scapula, let us first discuss the regions and the bones of the upper limb. Then I will be like discussing the other parts as well, right? So yes, good evening, Rohit. So yeah. Mhm. Sure. Now guys, you already know that we have something called as the shoulder joint above, right? And yes, we have the shoulder joint above. Somewhere we have the elbow joint over here, right? And below we have the wrist joint. Below we have the wrist joint. So try to focus, guys, that we have the shoulder joint, shoulder joint. We have the elbow joint, and we have the wrist joint, the wrist joint. Now, from the shoulder region, Chetan, good evening. Now, from the shoulder region up till the elbow, this region it is called as brachium in Latin. This is called as brachium in Latin, or it is also called as the upper arm. It is also called as upper arm. From elbow to wrist, this is called as antebrachium. This is called as antebrachium, right? Or it is also called as forearm, forearm, antebrachium in Latin. And yes, below the wrist, this part it is called as the hand. This part it is called as the hand. Now, guys, the parts or the regions of the upper limb, the very first region it includes, you should know, guys, that is the shoulder region, right? So this is yes, the shoulder region, guys. Remember the very first part which it includes, it is the shoulder region. Now, when I say shoulder region, it is divided into various subparts according to upper limb. This shoulder region, yes, I'll be dealing with the entire upper limb. So yes, good evening. So this shoulder region, Yes, Amrita, good evening. Guys, just try to focus over here. This shoulder region, it is divided into various no subdivisions it has. The first, guys, we have the pectoral region. Now, when I say pectoral, guys, pectoral basically I'm talking about, yes, the anterior chest region. Okay, the anterior chest region, okay, where your breast is present, right? The anterior means the one which comes in front. आगे वाला हो गया जहाँ पे आपका breast भी present है, तो anterior breast या anterior chest region भी बोल सकते हैं. So this shoulder region basically includes, yes, the pectoral region. Yes, the first part, we have the pectoral region on the front of the chest, on the front of the chest. Now the region is also including the memory part also, the memory glands also, right? So we have this, the pectoral region on the front of the chest. Then we have this part over here. Okay, that is the B part. Okay, this is this part. Okay, that is comes in the shoulder region only. This is the axilla or the armpit. We have axilla or armpit. Okay, so this is the axilla only, right? And the third one that is again very important, guys, this one, that is the scapular region. That is the scapular region over here, right? That is the scapular region over here, right? So the third region, so this is the B, and the C1, we have the scapular region on the back. Now can anyone tell me in the scapular region which bone is present, guys? Again in the name only, scapular region on the back, scapular region on the back. So the shoulder region basically consists of, this shoulder region basically consists of pectoral, axilla, and also the scapular region which is present on the back. The scapular region which is present on the back, right? Now, apart from that, the other part, other one, guys, you already know shoulder region we have discussed. It has like three parts: the pectoral, okay, the which consist of the clavicle and these memory glands. We have the axilla and we have on the back side, yes, the scapula. Genal mutate Sai Krishna Archana, very good, very good. Now, the second one, we have the upper arm or the brachium, right? It is from the shoulder to the elbow. Okay, the second one. The third one, we have the antebrachium or the forearm. And the fourth one, it is the hand. The fourth one, it is the hand. So basically, yes, we have like four regions in the upper limb that we have to discuss in detail. The first is the shoulder region. The second, it is the upper arm. The third, it is the forearm. And the fourth one, it is the hand. The fourth one, it is the hand, right? So now, guys, if I ask you which two bones, okay, forms the shoulder and are they are part of the upper limb, can anyone tell me which two bones they're forming the shoulder region specifically, and they are part of the upper limb as well, right? So just try to comment in the chat box, and we'll be focusing on these regions and the bones right now. So these were the regions. Now let us start with the bones of the upper limb. The bones of the upper limb. So whenever we are saying the shoulder region, it is the anterior chest wall, the axilla, and also the scapular region. So in totality, the shoulder region is made of three things: the anterior chest wall, the uh, armpit or the axilla, and the scapula. Mutinate, it is right. It is humerus and scapula, but basically, if we talk about humerus, basically can be a part of the upper arm as well. Archana, yes, it is right. Shiv, yes, it is right. So over here, let us first try to see in the pectoral or the upper arm, the first bone that you have to know, guys. Yes, that is the clavicle. That is the clavicle. Clavicle, it is the anterior bone of the shoulder girdle. Now, when I say anterior, guys, anterior means आगे की तरफ है. It is present in the front and it is forming the shoulder region. It is forming the shoulder region, right? So remember, guys, the clavicle, it is, firstly, you should know that it is two in number, one plus one, right? And it is the anterior bone of the shoulder girdle. Shoulder region, I would say. Okay, shoulder girdle बोल लो, or you can say shoulder region, right? It is the anterior bone of the shoulder girdle. Guys, remember, this is the anterior view. This is the anterior view, and this one, it is the posterior view. Anterior means you're watching all the bones from the front, and the posterior means you're watching it from behind. You're watching it from behind, right? So remember, guys, the clavicle, it is the anterior bone of the shoulder girdle, and it is two in number, one plus one, one of the right side and one of the left side. Then we have a flat triangular bone over here. This bone, can you see it's shaped like just like a triangle, right? And it is a flat bone. Okay, it is a flat bone. This is called as scapula. This is called as scapula. Scapula is also present 1 plus 1. And remember, it is located behind, guys. Okay, in the scapular region. It is located behind in the scapular region. So remember, guys, this is the posterior bone of the shoulder girdle. This is the posterior bone of the shoulder girdle. Now, this clavicle and scapula, guys, this clavicle and scapula, they are both present in which region, guys? Can anyone tell me in the chat box? They are both present in which region, guys? So you should be aware that they both are present in yes. One, it is forming the anterior part of the chest wall, like one, it is on the scapular region. So they both are part of the pectoral region. Okay. They both are part of the shoulder region, right? They both are parts of the shoulder region, right? They both are parts of the shoulder region. Yes, mutant, very good, very good. Again, some guys will say me, no, sir, this arm, okay, this arm, okay, this bone, the third one, it is the humerus. Humerus. This humerus is also present 1 plus 1. Now this humerus is the one which is forming the shoulder joint. This is the one which is forming the shoulder joint. Nikinder, good. Now you can very well see we have the head of the humerus joining with the glenoid cavity of the scapula. This is the glenoid cavity, and we have the head of the humerus. So basically this is a ball and socket joint. The head of the humerus is like a ball, and we have a socket like the glenoid cavity, and the head fits into the glenoid cavity, forming the ball and socket joint. So this humerus can be a part of shoulder region as well, and it can be more or less a part of the upper arm, because majority of the humerus, it is in which region? It is in the arm region, guys. It is present in the upper arm, right? So this is one which is the arm region, or we call it as brachium, brachium, or the upper arm, upper arm. So this humerus, it is basically the bone of the arm. Okay, bone of the upper arm. Better write it like this. It is the bone of the upper arm, or brachium. Now, we again have two bones over here. We again have two bones over here, guys. Let us suppose, guys, that this is the midline of the body. Let us suppose that this is the midline of the body, and And anything which lies closer to the midline is said to be medial. Anything which lies closer to the midline is said to be medial. Now, guys, there are two bones. One, it is the ulna, okay, or let me mark it with the same color. And you guys are going to tell me which one will be the medial bone of the forearm and which one will be the lateral bone of the forearm. So we have, yes, this bone, that is number 4, that is the ulna, and we have number 5, that is the radius, that is the radius. Now ulna and radius, they are both 1 plus 1, they are also 2 in number. And you guys are going to tell me which one is the medial bone of the forearm and which one is the lateral bone of the forearm. Yes, MuteNet, very good. Ulna, it is basically the medial bone. Now this region, it is the forearm only. The ulna lies closer to the midline. Anything which is closer to the midline of the body is said to be medial. And the other one will be lateral. Yes, Sai Krishna, very good. So ulna, it is the medial bone of the forearm. Medial bone of the forearm. And radius, it is the lateral bone of the forearm. Lateral bone of the forearm, or the antebrachium, right? So we have the medial bone of the forearm and the lateral bone of the forearm. Yes, Satvik, Nitha, Rutika, Shiv, various. बेटा रेडियस मीडियल कैसे हो सकता है? जो चीज मिड लाइन के करीब होती है बेटा वो होता है मीडियल. अब अल्ना देखो ब्लू लाइन के ज्यादा करीब है. सपोज ये मिड लाइन है बॉडी का, है ना? तो अल्ना बेसिकली मिड लाइन के ज्यादा करीब है तो वो मीडियल होगा. और रेडियस मिड लाइन से दूर है एज कंपेयर टू अल्ना. दैट्स व्हाई द रेडियस इट इज द लिटरल बोन ऑफ द फोरआर्म. ये तो दिख रहा है, राइट? नाउ this region, it is called as the forearm or antebrachium. Forearm or antebrachium. Forearm or antebrachium. Now guys, let us now discuss below this guys. Remember, this part, it is called as the hand. It is called as the hand. I will be discussing on the other side, and I will be discussing on the other side. Yes. So remember guys, you are, I think, already aware that this one, it is the shoulder joint. This one, it is the shoulder joint. We have the elbow joint over here. Elbow joint. And we have the wrist joint over here. Wrist joint. Now from shoulder to elbow, this is upper arm or brachium. From elbow to the wrist, this is forearm or antebrachium, and below the wrist, it is the hand. Below the wrist, it is the. Now let us just try to discuss in the other slide. Yes, we have discussed the regions, we have discussed the bones. Now let us first, okay, I think you guys already know. Can anyone answer this first question? Yeah, I will be discussing the hand in the other slide. But before that, okay, let me just first teach you, yes, the bones of the hand, then we'll come to that part also. We'll be discussing after the bones on the hand, this part, I mean the bones of the upper limb, right? Now, bones of the hand, let us just try to focus first. We will try to draw. Guys, every time in anatomy, whenever I'm teaching, you guys have to draw. I'm not asking you to be an artist. Draw the diagrams technically. Okay, line diagrams are enough to understand the concept. Okay, diagram should be technically correct. Nothing artistic is required. I will be drawing the technically correct diagram of the hand today in front of you, and you will be following this with me, right? So let us start with the bones of the hand. Now see first, the hand, it is basically divided into 3 regions, right? The hand, it is first divided into 3 regions, right? The subdivisions of the hand. We have wrist, then we have hand proper. We have hand proper, and we also have the 5 digits. Okay, we also have the 5 digits. Now, firstly, we'll talk about the wrist. Guys, remember, in the wrist, जिसको हम कलाई बोलते हैं बेटा, in the wrist, we have bones which are called as carpal bones. Okay, the wrist is also called as carpus. Okay, carpus. So basically, the wrist in Latin it is the carpus, and wrist made up of carpal bones. Made up of carpal bones. Now these carpal bones, remember they are present like 8 in number. Okay, they are present 8 in number, 8 in one hand and 8 in the other hand, 8 in one hand and 8 in the other hand. Now let us just try to draw this. Now in the hand, the labeling always start from lateral to medial. Okay, the labeling always starts from lateral to medial. लेटरल का मतलब देखो, मीडियल का मतलब होता है जो बॉडी की मिड लाइन से क्लोज है, और लेटरल का मतलब क्या होगा, जो बॉडी की मिड लाइन से क्लोज नहीं है, एज कंपेयर टू दिस. सो कार्पल बोन्स दे आर अरेंज्ड इन 2 rows. They are arranged in 2 rows, right? 4 in each row. 4 in each row. Now guys, if you just try to see over here this particular thing, now you already know we have this which is called as thumb, and this one, it is the little finger. It is the little finger. Now my question to you people, in the normal anatomical position, everything in anatomy, it is described under the normal anatomical position. Now you guys are going to tell me, out of little finger and thumb, which one is closer to the midline? चलो बताओ. Out of little finger and thumb, which one is closer to the midline? लिटिल फिंगर और थंब में से क्या क्लोजर है, तो हमें मीडियल और वो पता चलेगा. यस, वेरी गुड म्यूट ने, लिटिल फिंगर इज क्लोजर टू द मिड लाइन. वेरी गुड, वेरी गुड. तो अनिल सैनी, यस, द लिटिल फिंगर इट इज क्लोजर टू द मिड लाइन. चलो, तो हमें पता चल गया कि हम लोग जो है, वी आर टेकिंग द लिटिल फिंगर, ओके, दिस साइड, लिटिल फिंगर ऑन दिस साइड, and we are taking thumb on this side, right? We are taking thumb on this side, right? So thumb means it is lateral, and little finger means it is medial. It is medial. So we are going to draw, we are going to label them in such a way that the labeling goes from lateral to medial. Now, the first row, guys, it is called as the proximal row. बेटा बॉडी में जो पहले आता है उसको हम लोग क्या बोलते हैं, proximal, और जो बाद में आता है that is called as distal. Proximal starts from the word p. P means पहले. Okay, it comes like the first in the body. Okay, or it's more aligned towards the center of the body, right? D means distal. Distal मतलब दूर. So the first row, it is called as the proximal row. Proximal row. And the other one will be called as the distal row. Distal row, right? In the proximal row, how many bones are there? There are 4 bones. And in the distal row, also we have the 4 bones. Also we have the 4 bones. Yes, Shiv, very good. Lashika, very good. Now, now see guys over here that starting from the lateral to the medial, guys, हमेशा lateral से medial चलना है. In the proximal row, the first bone, it is scaphoid. Scaphoid. First, you should know the name of the bones, and we'll be discussing the each characteristics of the bone also. Then we have lunate. Then we have triquetral and pisiform. Pisiform. Scaphoid, lunate, triquetral, and pisiform. Scaphoid, lunate, triquetral, and pisiform. So, beta, the carpal bones, how you can remember it with the help of a mnemonic proximal region from lateral to medial. S, scaphoid. Proximal, the first row, she looks too pretty. L stands for lunate. T stands for triquetral. And P stands for pisiform. Pisiform. She looks too pretty. Okay. Look in there. Yes. Very good. Now, other row, again beta, we have to start the labeling from lateral to medial. Again, हमने पहले lateral से medial गए, scaphoid, lunate, triquetral, pisiform. थंब से कहाँ जाना है? लिटिल फिंगर की तरफ. थंब से कहाँ जाना है? लिटिल फिंगर की तरफ जाना है. ठीक है, थंब से लिटिल फिंगर, लिटिल लेटरल से मीडियल की तरफ. देन वी हैव ट्रेपीजियम. ट्रेपीजियम, ट्रेपीजॉइड, ट्रेपीजॉइड, कैपिटेट, कैपिटेट, और लास्ट वाला हो जाएगा हैमेट. कैपिटेट, हैमेट. अब नाउ स्टूडेंट्स आर कंफ्यूज्ड कि ट्रेपीजियम or trapezoid. If you can see guys, trapezium and trapezoid, they both have common trapez and trapez. Then it is IUM, IUM, and over here it is OID. Now according to English alphabet, I comes first, trapezium. So trapezium will come first, then we have trapezoid. Okay, out of O and I, which comes first? I comes first, so trapezium, then we have trapezoid, then we have trapezoid. Okay, try to catch her, beta, just try to mention the names. We have trapezium, trapezoid, capitate, and hamate. Capitate and hamate. Capitate and hamate. Right. Now guys, try to see over here. Now, in the wrist, जो बेटा कलाई बना रहे हैं आपकी wrist, we have carpal bones. Now, in the hand proper, guys, in the hand proper, please remember it is called as metacarpus, okay, in Latin, and it is made up of metacarpals. It is made up of metacarpals. Metacarpals. Metacarpals, they are again 5 in one hand and 5 in the other hand. 5 in one hand and 5 in the other hand, right? So the hand is divided into wrist, the hand proper, and then we have 5 digits, right? 5 digits, metacarpals. So let us just try to draw the metacarpals. We have like 5 metacarpals, okay? And again, the labeling will go from lateral to medial. 1, 2, 3, 4, and 5. We have 5 metacarpals. Again, the naming will be from the lateral side to the medial side, and the naming is in Roman numerals. First metacarpal, second metacarpal, third metacarpal, fourth metacarpal, and the fifth metacarpal. So we have how many metacarpals over here? Yes. So remember guys, these are the carpal bones, carpals, right? This is the metacarpal. Metacarpals. Metacarpals are five from, yes, from lateral to the medial. We also have, yes, the phalanges. In the thumb, guys, remember, we have only two phalanges, while in rest of the digits, we have three phalanges, right? Each. So this is nothing but the phalanges, right? So remember, these are nothing but the phalanges. Phalanx is referred to as one. We have phalanges. Now, anything which comes like, yes, we have the proximal phalanx, we have the distal phalanx. Proximal, distal. The one which comes in the mid, it is the middle phalanx. Okay, we have proximal, middle, and distal phalanx. Proximal, middle, and distal phalanx. P, M, and D. P, M, and D. Yes, and P, M, and D. So how many phalanges are there? How many phalanges are there? Try to comment in the chat box. Try to comment in the chat box, right? And yes, we have like in 5 digits. Now, if I say 5 digits, guys, so remember, okay, if I just have to know, um, okay, the first one, guys, remember, the first one is called as thumb, right? It is called as thumb. And thumb has how many phalanges? Two. Thumb has how many phalanges? Mutinate, Sai Krishna, Nikinder, Khushi, Satvik, very good. Yes, Shiv Kumar, very good. Now, in the this this is called as the first finger. Okay, thumb is also called as pollex. Guys, thumb is also called as pollex. Okay, if I ask you which phalanx is absent in the thumb, which phalanx is absent in the thumb? Which phalanx is absent? Akshit, Anil, very good, very good. Now this is called as, yes, this is called as the index or the forefinger. This is called as index or forefinger. Forefinger. Yes, mutenet. Yes, middle wala absent होगा ना नितिन? Middle. Middle is not there. Proximal and distal. If there are two, we have to just mention proximal and distal. The one which is absent, it is the middle. Then remember, guys. Yes, we have index and forefinger. Then we have the ring finger. Then we have the ring finger, right? Sorry, ring I'm telling. This is the middle finger. This is the middle finger. And this one, yes, this is the ring finger. Okay, the engagement ring finger. And this is the, yes, you already know this is nothing but the little finger. Little finger. Yes, little finger, right? So they are also named like first to fifth. The thumb, it is referred as one, right? The thumb, it is referred as one. Then we have index or forefinger 2, middle finger 3, ring finger 4, and 5 1, it is the, yes, the little finger, right? So yes, so 5 digits, we have how many? Basically, yes, the phalanges are 14 plus 14, right? So the bones of the hand, they are 27 plus 27. 27 plus 27 in one hand and 27 in the other hand. I hope, guys, the bones of the hand are clear to one and all. Just give me a thumbs up in the chat box if the bones of the hand are absolutely clear to you, right? If the bones of the hand are clear to you, people, right? So we have already discussed the bones of the hand in a very legit diagram, right? Just a simple diagram I have drawn. Yes. बेटा हमेशा lateral से start करना and please try to go from thumb lateral to the medial, right? From thumb to the medial, right? अच्छा, बहुत बढ़िया, बहुत बढ़िया, very good. खुशी म्यूटन लोकेंद्र अभी नितिन रिकेंडर मोहम्मद सिद्दीक अनिल very good. So let us now just try to fill out these certain questions that are given over here. Bones of the shoulder girdle. Anteriorly, beta, we have the clavicle, right? We have the clavicle. पीछे की तरफ जो shoulder region बना रहा है, we have the scapula. Bones of the arm, it is the humerus. Bones of the forearm laterally, beta, it is the radius. Medially, it is the ulna. And bones of the hand, carpal bones, basically, yes, we have 8 in number, right? We have 27 plus 27. So we have carpal bones that are 8 in number, metacarpals, which are 5 in number, and digits, they are 14 in number, right? Rest all clavicle is 2, scapula is 2, humerus is 2, radius is 2, ulna is 2, right? And the rest, yes, you can very well fix over here, right? I hope this is clear to every one of you. So yes, before moving on to the X-ray also, just try to mention, okay, which metacarpal is this? A. Which metacarpal is this? Which, what is B, right? And what is C? What is A, B, and C? Just try to comment in the chat box, okay? I'm moving further. Yes. Now, guys, you can very well see this is the glenoid cavity. This is the glenoid cavity, and this is the head of the humerus. Okay, the humerus bone. The humerus bone. And this is the shoulder joint, which you can see. And you can also see the clavicle over here. A is the third metacarpal. Nikinder Reddy, very good. Kushiko Swami, very good. A is the third metacarpal. Right. Mutnet, A is the third metacarpal. A is the third metacarpal. Right. Third metacarpal. Mutnet, very quite good. B, it is trapezoid. Trapezoid. Yes, B is trapezoid. ठीक है. And C, it is. Very good, Nitin. C, it is pisiform. Yes, pisiform. Very good. Mutnet, very good. Khushi Goswami, very good. Very good, very good, very good. Very good. So we have already covered the bones in the detail, right? The regions, the bones of the upper limb, right? The bones of the hand done, right? We have seen this part also, right? Now, guys, you guys are going to tell me what has happened over here. Okay. I hope you can very well fix it out. Which phalanx is this? Which phalanx is this? Proximal, distal, middle, and which metacarpal is this? You guys are going to tell me. As of now, I'm just trying to show you the normal ones, right? Yeah. नहीं, अक्षय देखो क्या होता है. देखो, ये आ गई हमारा रीजन किसका आ गया? डिजिट्स का. ठीक है, डिजिट्स का आ गया. डिजिट्स में क्या होता है? सिर्फ फैलेंजेस. ये वाला हो जाएगा प्रॉक्सिमल, ये हो जाएगा डिस्टल. proximal, middle, or distal? Proximal, middle, or distal? है ना, मिडिल वाला होगा. Yes, it's a dislocation of the middle. देखो हड्डी टूटी नहीं है. Please just try to fix over here that the bone is not broken. It is the middle phalanx which is now deviated from the proximal phalanx. Of which finger? It is the little finger. Little finger, in which the middle phalanx is dislocated from the proximal phalanx, right? So that is something you guys have to remember. Nikinder, Nathan, very good, guys. Now, can anyone tell me which bone is this? What is A and what is B? Sure. What is A and what is B? Hmm. नहीं बेटा. Just try to look over here. Now, this bone B, it is the radius, and A, it is the ulna. A, it is the ulna. Now, guys, in a given X-ray, how to identify which one is the radius and which one is the ulna? Remember, guys, the radius is the one which forms the wrist joint. Ulna never participates in the wrist joint directly. It is the scaphoid and lunate. It is the scaphoid and lunate. Okay, and this is the lower end of the radius. So the wrist joint, guys, remember the wrist joint. I've already told you before also, it is also called as the radiocarpal joint. Radiocarpal joint. Basically, it is formed from radius and the carpal bones. And which two carpal bones, guys? We have scaphoid and lunate. Ulna directly never participates in the elbow joint. In between, if you can see the space, guys, right? This space is present. Over here, basically, some tissue is present, the ligament is present. Okay. So basically, ulna is not joining to the carpal bones directly. There is some ligament which does not comes in the X-ray. So that is a trick that ulna will never join to the carpal bones directly, right? So the one which is not joining to the carpal bones directly, you can very well see it is the ulna. It is the ulna, right? And you can very well see that the fracture, we have the fracture of ulna, fracture of shaft of ulna, right? We have fracture of shaft of ulna, right? Shaft बीच वाला part क्या होता है? Shaft ही होता है, right? So we have the fracture of the shaft of the ulna, right? Now, we've already discussed this. Now put the heading as osteology of the clavicle. I hope the guys, the X-rays are being clear, right? How to, you always have to go from lateral to medial, right? Okay, lateral is always thumb in the normal anatomical position. You have to keep the normal anatomical position in your mind. Then you have to move on to the other part. So I hope till now everything is clear, right? The regions of the upper limb, the bones of the upper limb, right? The bones of the hand, the normal X-ray, right? One I have shown dislocation and the one I have shown the fracture of the ulna, how to identify ulna and radius on the X-ray, right? Now, I hope this is clear. Just give me a thumbs up in the chat box. Then we are going to start with the osteology of the clavicle. The osteology of the clavicle. Now, this clavicle, guys, which I will be discussing, it will be the complete clavicle. Right? So I will be discussing the entire clavicle right now. Right? Chalo, Khushi, Lokinder, MuteNet, very good. Very good, guys. Abhi, Shelly, very good. Very good. Now we are going to discuss the osteology of the clavicle. Now, guys, firstly, whenever you, okay, now there are two clavicles, right? The right clavicle and the left clavicle. Now, the very first thing that you have to do, guys, whenever in examination you pick up the bone and it is of right side, please hold the right part of the bone in the right hand. If it is a right side bone, hold the bone in the right hand throughout the explanation. If it is a left side bone, hold the bone in the left hand and then explain the examiner. It is the first rule in the anatomy practicals. Whichever side or whichever like side of the body the bone is, we have to hold that bone in that particular hand, right? We have to hold that bone in that particular hand. And first thing, whenever you start describing any bone, okay, so firstly, you have to tell the general points regarding the clavicle, and I hope you guys already know this. You can very well see that the clavicle, this is the clavicle, and this clavicle, it is basically located anteriorly. आगे की तरफ होता है clavicle. So remember, and it is forming the shoulder girdle or the shoulder region, right? So remember, guys, the clavicle, it is the anterior bone. It is the anterior bone of the shoulder girdle or the shoulder region. It is the anterior bone of the shoulder girdle or the shoulder region. Next, you should also remember that this bone is known as the collar bone or beauty bone. The collar bone or the beauty bone. Right? This is also known as the collarbone or the beauty bone. I will be discussing a clinical case today where I will show you a patient who is without the clavicle and how ugly he or she looks. Right? So that's why clavicle is the one which is called as the collar or the beauty bone. And remember, it helps in the formation of the shoulder girdle or the shoulder region or the shoulder region. So these are the first 3 points that has to be kept in mind while not describing the clavicle. Now, other thing that you should know, guys, yes, the type of the clavicle it is. So remember that the clavicle, it is atypical long bone. Very, very important. It is atypical long bone. Atypical long bone, right? It is atypical long bone. Okay, why this clavicle is termed as atypical long bone? Because it it shows it has no medullary cavity. As of now, some book says that it has medullary cavity. It a bone के if we just talk about any bone, guys, if there is any long bone. Now, the middle part of the long bone, it is called as shaft. And in the shaft, guys, in the middle of the shaft, we have a medullary cavity. In the middle, we have the medullary cavity. बाहर वाला पार्ट कॉर्टेक्स होता है और बीच वाला पार्ट क्या होता है मेडुला. So we have this medullary cavity, and remember, guys, the clavicle is the bone. It is having no medullary cavity. Very, very important. There is no medullary cavity. Very, very, very important. There is no medullary cavity as per the recent guidelines. Apart from that, it is also called atypical. Why? One reason is it contains no medullary cavity. The other reason it is, okay, all the long bones. Now, when I say humerus, okay, I'm talking about any long bone. Now, you already know what is a long bone whose length is more than width. जिसका length width से ज़्यादा होता है वो long bones हो गई. For example, just now three तो I have already discussed now. You already know the three. Yes, we have this, the humerus, right? We have the humerus, we have the ulna, we have the radius, we have femur, we have tibia, we have fibula, right? We have femur, tibia, fibula, humerus, radius, ulna. All long bones are developed from cartilage. Okay, bones can be formed by two things, right? Either from the cartilage or either from the membrane. Okay, and all the long bones, remember, guys, all the long bones, all long bones, they are developing from cartilage. And which cartilage? Hyaline cartilage. इससे बनते हैं ये hyaline cartilage से. Except, remember, except clavicle. Now, what is so special about clavicle? When we talk about humerus, radius, ulna, femur, tibia, fibula, all are formed from hyaline cartilage. But the clavicle is the one which is or which shows clavicle shows intramembranous ossification. Intramembranous ossification, intramembranous and cartilaginous ossification. Now, guys, remember that the clavicle is the one which is showing both intramembranous and cartilage. Intramembranous means that the clavicle is formed from the mesenchymal membrane, some part, mesenchymal membrane, and the cartilage, the clavicle, it is also formed from the hyaline cartilage. Ideally, all the long bones, they are formed from hyaline cartilage, but the clavicle is the one which is showing like intramembranous also and the cartilage also. Only there are two processes by which a bone can be formed, either by membrane or either by cartilage. So remember, the cartilage, it is only the medial end. Now, when I say medial end, guys, I'm talking about this end, which is towards the middle line of the body, which is towards the middle line of the body. Okay. So remember, the medial end, it is formed by cartilage, whereas rest of the clavicle is formed by membrane. Rest clavicle, except medial end. So this is an exception, guys. This is an exception. All long bones are formed from the cartilage, but the clavicle is the one which is showing intramembranous also and cartilaginous also. Cartilage से कौन से बन का पार्ट तैयार हुआ है? medial end वाला पार्ट. बाकी पूरा का पूरा जो intramembranous है, intramembranous जो है, remember, it is the entire clavicle which is intramembranously formed, which is formed by the membrane, right? Which is formed by the membrane, right? I hope this point is clear. That's why it is called as the atypical long bone. I hope this is clear. That's why it is called as the atypical long bone. इतना clear है सब लोगों को? जल्दी से एक thumbs up दे दो कि clavicle को atypical क्यों बोलते हैं? Because it has no medullary cavity and it shows both intramembranous and cartilaginous ossification. Cartilaginous ossification, guys, is also called as, okay, let me just mention this point as well. Cartilaginous ossification, yes, Lishika, Khushi, very good, very good. Cartilaginous ossification is also called as enchondral ossification. It is also called as enchondral ossification. It is also known as enchondral ossification. Chalo, Mutenet, Mohammad Siddiq, Anil Saini, very good. Now, coming on to the structure. Structure, guys, just try to remember one point. It lies at the root of the neck. It lies at the level of, okay, not, wait. Structure. हाँ, लोकेंद्र अभी उस पे भी आएंगे, हम सारे peculiarities बाद में लिखेंगे. Structure, remember guys, it is a S-shaped bone. It is a S shaped bone. अगर बेटा clavicle देखोगे, if you just try to see the clavicle, guys, it is more looking like a letter S. Okay, ये S की तरह दिख रहा है. So yes, this is like a letter S of S-shaped bone, and it lies at the level of root of the neck. Root of the neck. It lies at the level of the root of the neck. Does this have effect on age? What age? अभी हम ossification पे आएंगे. Ossification पूछ रहे हो? No, clavicle, why would it have any effect on the age of the person? It's just a bone. No. It lies at the level of root of the neck. बिल्कुल neck का जो root होता है ना, जहाँ से neck शुरू होती है. From there. Yes. अच्छा, ये हो गया. Now, ये ना anatomical position में लिखोगे तो ज़्यादा better रहेगा. Okay. It lies at the level of root of the neck. So I will just move this point to anatomical position, or I'll write it over here. An issue. So please write this point over here that what is it lies at the level of root of the neck. Root of the neck, right? And guys, remember, if we talk about the composition of the bone, one point also I need to mention over here. Yes, one point also I need to mention over here that this bone, it is formed of spongy bone covered by layer of compact bone. Covered by layer of compact bone. Covered by layer of compact bone. It is the spongy bone which is formed by spongy bone covered by layer of compact bone. Right? Spongy bone, compact bone, I've all discussed this in the general anatomy. So just remember कि पूरा का पूरा spongy bone का बना होता है and later it is covered by a layer of the compact bone. Okay, I hope this is clear. The anatomical position, the structure, right? The type, it's like the atypical long bone because of no medullary cavity and the mixed ossification, right? So the clavicle is showing which ossification, guys? Yes, mixed ossification. दोनों ही दिखा रहा है ना? Mixed ossification. Please mention this point also. Mixed ossification. Yes, partly membranous, partly cartilaginous. ठीक है, आधा मेम्ब्रेन का बना हुआ है और कुछ पार्ट कार्टिलेज का है. पूरा मेम्ब्रेन ही है, बस एक मीडियल एंड है जो किसका बना हुआ है, कार्टिलेज का बना हुआ है. Now, remember guys, what are the functions of the clavicle? So we have discussed the type, we have discussed the structure, we have discussed the anatomical position. I hope this is clear to everyone. Now come on to the functions of the clavicle. Come on to the functions of the clavicle. It prevents the drooping of the shoulder. Guys, remember, drooping का मतलब होता है कंधे का नीचे गिर जाना. It basically means the shoulder. It prevents the shoulder from falling down. Okay, it keeps the shoulder intact or in the right anatomical position. So it prevents the drooping of the shoulder, keeps the arm away from the tongue. Now, when I say trunk, guys, below the neck, what is this? Thorax, thorax, diaphragm, and abdomen. These all are parts of the trunk, right? So when I say trunk, trunk is not only thorax, it is thorax plus diaphragm plus abdomen. Okay, so this is entire trunk below the neck. So now when it says keeps the arm is shoulder joint to elbow joint, right? So it will not let the arm, okay, to like be in contact with this trunk. So it is keeping this arm away from the trunk, okay, so that the arm can swing freely, okay, without coming in contact with the trunk. ठीक है, trunk के करीब आने से, ठीक है, it will not affect the trunk anyways. It is just this clavicle is helping the arm to swing freely Abduction. देखो, the arm which is going away from the midline, it is called abduction. If it comes closer, it is adduction, right? So it is not involving the trunk. Okay, so this swinging, this abduction, adduction is done freely, right, with the help of this particular bone, right? It helps in the transmission of weight from the upper limb. बेटा ध्यान रखना, upper limb से जितना भी weight आता है, I will discuss the transmission also. From this upper limb, all the weight is coming to where? The axial skeleton. Okay. देखो, humerus, radius, ulna, they all are parts of appendicular skeleton. So all the weight from this via this clavicle acts like a bridge. ये बिल्कुल एक ब्रिज की तरह है. जितना भी weight upper limb का है, उस अब कोई बुक उठाते हो, बुक से वेट कहाँ जाएगा? हैंड, फोर आर्म, आर्म. ह्यूमरस से कहाँ जाएगा? स्कैपुला. स्कैपुला से देखो क्या ज्वाइन हो रहा है, क्रोमियन प्रोसेस से क्लैविकल ज्वाइन हो रहा है. क्लैविकल पे सारा वेट आकर इट विल कम ऑन टू विच, लाइक द मीडियल बोन्स, दैट इज द एक्शियल skeleton bones, right? So it also assists in the movement of the arm above the level of the shoulder. Okay, so the movement of arm can, like the arm also can go up. Okay, it is above the level of the shoulder. It is also, this bone is also helping in the movement of the arm above the level of the shoulder, right? So I hope this is clear to everyone. The functions of the clavicle. The functions of the clavicle. चलो फटाफट से एक thumbs up दे दो if the functions are clear to everyone, right? वेट ट्रांसमिशन अभी हम दोबारा डिस्कस करेंगे. एक एक चीज बताऊंगा कि कहाँ से कैसे कैसे फोर्स ऑफ वेट इज गेटिंग ट्रांसमिटेड फ्रॉम द अपर लिम्ब टू नो द एक्सियल skeleton. So yes, we'll be discussing that point again with a question that is a past year question and I will previous year question. So yeah, चलो खुशी अभी, very good, very good. We have already discussed the type, structure, anatomical position, functions, and some general points. Now, before coming on to the peculiarities of the clavicle, side determination, and the other clinical parts, right, and ossification, let us first discuss, yes, the parts of the clavicle. Shiv, very good. Sai Krishna, Satvik, very good. Shaila, very good, very good. Now let us discuss the parts or the features of the clavicle. Put the heading, yes. Hmm. Beta, in one flow chart, I will be giving you all the parts. In one flow chart, I will be giving you all the ligaments. In one flow chart, I will be giving you all the joints also, right? So you guys just have to be very much attentive. I will be discussing all the things in the one flow chart, all the muscular attachments in one flow chart, right? So parts of the clavicle. Please try to make a big flow chart. Try to rotate your notebooks and make a big flow chart. Parts of the clavicle. Parts of the clavicle. Now remember, the clavicle is divided into two ends and one shaft. The clavicle, it is divided into two ends and one shaft. No, I will tell you the reason of fractures also. I'm coming on to the clinical part after this, Lishika. Then we'll be discussing it. Yes. So we have like two ends of the clavicle. Yes. Sadat, thank you so much. Love from Afghanistan. We have two ends and we have one shaft. We have one shaft and two ends. Now, now, Let us first discuss about the ends of the clavicle right now. We have two ends and one shaft. So let us first try to look at this picture over here, guys. Now, remember guys, the clavicle, it has two ends. One end, I'm just talking about the end, guys. One end is this, and the other end is this. So we have two ends, and the middle part of the clavicle, it is said to be shaft. The longest part of the bone, it is called shaft or the body of the bone. Body of the bone, right? So remember, we have the long shaft and we have one end over here and one end over here. So how many ends are there? Two ends of the clavicle are there and one shaft. First, we'll focus on the end. Now, guys, if you can just see over here, guys, in this particular picture, you're watching the clavicle from above. You're watching the clavicle from above. Now, this is the clavicle. और clavicle को आप कहाँ से देख रहे हो? ऊपर से देख रहे हो. This is the superior view. Now, this is which view, guys? This is the superior view. This is the superior view, right? So we have two ends. एक end ये रहा और एक end ये रहा. Now, this is A and this is B. You guys are going to tell me which end is the medial end and which end is the lateral end. चलो, medial का मतलब क्या होता है? Anything which is closer to the midline is said to be medial. और lateral का मतलब होता है anything which is away from the midline is said to be lateral, right? So you guys are going to tell me which is the medial end and which is the lateral end of the clavicle. जो भी बॉडी के मिडलाइन के पास आ रहा है, लेट अस सपोज ये बॉडी का मिडलाइन देख रहे हो ना, ये बॉडी का मिडलाइन है. बॉडी का मिडलाइन मतलब ये कौन सी बोन है? स्टर्नम है. ये तो स्टर्नम है और स्टर्नम तो बिल्कुल बॉडी के मिडलाइन में लोकेटेड है. तो ए जो है बेटा, जो चीज बॉडी के मिडलाइन के पास है वो तो ए है. तो ए क्या हो जाएगा? इट विल बी द मीडियल एंड ऑफ द क्लेविकल and B will be the lateral end of the clavicle. Yes, everyone is right. Mutenet, Sai Krishna, Lokender, very good. Nikinder Reddy, Anil Seni. Yes. You guys are right. Absolutely right. जो चीज बेटा बॉडी के मिडलाइन के साथ है वो मीडियम एंड द one which is away from the midline, it is said to be lateral. It is said to be lateral. Medial end बेटा किस बोन की तरफ है? स्टर्नम की तरफ है. Medial end is towards the sternum. So this medial end, it is also called as sternal end. इसको हम लोग क्या बोलते हैं? Sternal end भी बोलते हैं, right? Why? Because the medial end is towards which bone? Sternum. So the medial end is also called as sternal end, right? Lateral end is towards which process of the scapula? ये देखो एक बोन का टुकड़ा बाहर निकला हुआ है. You can very well see a part of the bone which is coming from the scapula, right? Now this is the, yes, acromion process of scapula. This is which bone? That is the acromion process of scapula. That is the acromion process of scapula, right? Now, so the lateral end, ये वाला जो end है, lateral end जो है, तुम अगर ध्यान से देखोगे, this lateral end, let me just mark with this lateral end, it is towards which part? Acromion process of scapula, right? So this end, it is also called as acromial end. This is also called as acromial end. बेटा प्रोसेस का मतलब वो है बोन का वो टुकड़ा जो बॉडी से बाहर निकला हुआ हो. तो जब स्कैपुला देखो पीछे की तरफ है. तो स्कैपुला की बॉडी से एक बोन का टुकड़ा बाहर की तरफ आ रहा है. ओके, दैट इज कॉल्ड एज प्रोसेस एंड द नेम इज एक्रोमियन प्रोसेस. अब मीडियल एंड जो है और स्टर्नल एंड जो है, यू गाइस आर गोइंग टू टेल मी इट विल फॉर्म व्हिच जॉइंट, गाइस? मीडियल एंड देखो ये स्टर्नम रहा, और स्टर्नम का कौन सा पार्ट है ये? मेनोब्रियम है। ठीक है, मेनोब्रियम है। स्टर्नम का कौन सा पार्ट है? मेनोब्रियम है। और ये कौन सी बोन है? क्लेविकल। क्लेविकल एक बोन है एंड स्टर्नम इज ऑल्सो अ बोन. So the joint will be sternoclavicular joint. Sternoclavicular joint. Sternoclavicular joint. And the one which is joining to the acromion process of scapula. Okay. अब ये वाला कौन सा joint बन जाएगा? Clavicle है. Clavicle is a bone and we have acromion process of scapula. So this joint, two bones are joining. This is acromioclavicular joint. Acromioclavicular joint. Is this clear, guys? Both the ends are clear. Okay, both the names of the ends are clear and what they are forming. So let us add on this information to our slide. Okay. Hmm. Now guys, how to identify also which one is the lateral end and which one is the medial end. If you just see the clavicle, guys, please be very clear with the fact that the medial end is rounded in structure. It is rounded in structure. ये it's a trick. ये पहचान होती है medial end की. तो medial end पहचानोगे कैसे बेटा? Remember, the medial end is rounded in structure. Okay, the medial end is rounded in structure, whereas the lateral end beta, it is flat. चपटा होता है बिल्कुल. Okay, so the lateral end, how will you identify, guys? The lateral end is flat while the medial end is rounded. और quadrangular भी बोल सकते हैं. Quadrangular मतलब जिसकी 4 साइड होती है. Okay, triple 3 side, quadrangular 4 side. So it varies from person to person. It can be rounded or quadrangular. Okay, rounded or quadrangular. Let us just try to mention this. We have two ends, guys, over here. We have two ends, right? We have the, yes, let me use this pen. We have the medial end. Medial end is also known as the sternal end. Sternal end. Remember, the medial end is, how to identify, guys? It is quadrangular in, it is rounded or quadrangular in shape. Quadrangular in shape. It is rounded or quadrangular in shape, right? And it helps in the formation of a joint, guys. Be very clear. All the joints in blue color, guys. Please. It helps in the formation of a joint that is called as the sternoclavicular joint. Sternoclavicular joint. Sternoclavicular joint. Okay. Sternoclavicular joint. All the important points to be written in one slide only. Okay, it helps in the formation of sternoclavicular joint. The other one, guys, the other one, we have the lateral end. The lateral end, it is also called as the acromial end. Now this acromial end or the lateral end, remember, it is flat. It is flat and it helps in the formation of a joint called as acromioclavicular joint. Acromioclavicular joint. Please, all the joints with the blue color, follow a color code. Okay, acromioclavicular joint. क्या इतना clear है सब लोगों को? Just give me a thumbs up in the chat box if this is clear to everyone over here. Okay, if this is clear to everyone over here, right? Kushi, Lokendra, Sai Krishna, Satvik. Very good. Very good. What about rest? Now, now, guys, I will be coming to more. Okay, later with the ligaments part also. But as of now, let us just first try to know. Okay, okay. Cover the rest parts, then we'll come on to that also. Okay. Kushi, Lokendra, Sai Krishna, Satvik, Nikendra, Shravya, Shiv, Mutnet, Mohammed Siddiq. Very good. Very good. Now, let us now focus on the shaft. The shaft. Now, the shaft of, yes, the shaft is again divided into two parts. The shaft is again divided into two parts. Now, now, let me use picture over here. Okay. Now, if you can see, guys, the shaft, we are dividing the shaft into two parts. Okay. Or let me first show you over here. Yeah. I'm dividing the shaft, the body, into two parts. Okay. Now, let us suppose that this is a clavicle. This is a clavicle. Okay. And I have divided the clavicle. I'm going with the latest edition, okay, of Grey's Anatomy. Please don't go with the books, right? It's the information is updated in Grey's Anatomy. So we are dividing the clavicle into five parts. One, two, three, four, and five. One, 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 one. We have five parts of the clavicle. We have five parts. We are dividing the clavicle into five parts. So I'm taking a fraction. I'm taking two parts out of five, and I'm taking three parts out of five. So the fraction will be 3/5 and 2/5. मैंने पूरे clavicle को पांच parts में बांट दिया. Divided the whole clavicle into five parts. I'm taking three parts together and two parts together. Right? I'm taking three parts together and two parts together. So this one, guys, this one, it is 3/5. And remember this one, it is 2/5. We already know this is the medial end. This is the medial end because of the shape. And this is the lateral end. This is the lateral end, right? This is the lateral end. This is the medial end. And this one, it is the superior view. ऊपर वाली जो picture है, this is the superior view. Superior view मतलब हम लोग clavicle को ऊपर से देख रहे हैं. Okay, for example, the clavicle is like this. You're watching the clavicle from above. And the next picture, it is the inferior view. It is the inferior view. We are watching the clavicle from below. We are watching the clavicle from below. Okay, like this. I'm just trying to show like this. You cannot go down and see the clavicle, so I'm showing you it like this. But this is the inferior view of the clavicle. Okay, the one which is down. Okay, that is the inferior view, and I'm showing in the books. Okay, below the picture it is written which one is superior, which one is inferior view. So you have to be very clear. Inferior means this is the lower part of the clavicle, okay, and it is the inferior part of the clavicle, and it is shown in the book like this. Okay. Now guys, why the question is why we have taken 3/5 and 2/5? Why not 2/5, 1/5 and 4/5, or 3/5, or like 3/5 I can take on the lateral end, or 2/5 towards the medial end? Okay, guys, now the question is, the answer is over here, that the medial, the 3/5 part, it is basically in the form of a shape that is called as cylinder. बेटा अगर इसकी शेप देखोगे 3/5 की, ठीक है, मीडियल से 3/5 तक इसकी जो शेप है वो किस फॉर्म में है? सिलेंड्रिकल शेप है. इट इज सिलेंड्रिकल इन शेप. इट इज सिलेंड्रिकल इन शेप, राइट? दैट्स व्हाई इट इज सिलेंड्रिकल इन शेप, राइट? बल्कि 2/5 जो है वो क्या है, पूरा का पूरा फ्लैट है, पूरा का पूरा चपटा है, जस्ट लाइक दिस टेलीफोन, पूरा का पूरा फ्लैट है। जबकि मीडियल 3/5 जो है, मीडियल देखो 3/5 मीडियल एंड की तरफ है, तो 3/5 क्या हो जाएगा, मीडियल, और 2/5 it is towards the lateral end, so it will be the lateral. So we have medial 3/5 and 2/5. Medial 3/5 by because this whole portion is cylindrical in shape. Cylindrical is just like this. Can you see the cylinder? Okay, the gas cylinders in the home, it's just like this. And flat, I have already shown you flat is like this, right? Flat is like this shape, right? So that is yes, that is you have to guys remember over here. Okay, so remember, let's add into our flowchart, guys, that parts of the clavicle we have, right? Hmm. We have the medial 3/5 and the lateral 2/5. Okay, lateral, medial 3/5 and lateral 2/5. Why medial 3/5 and lateral 2/5? Remember, guys, the medial 3/5, it is, yes, it is again cylindrical in shape, cylindrical in shape. The lateral 2/5, it is flat in shape. The lateral 2/5, it is flat in shape, right? We have divided the shaft into 5 parts. 3/5 part from the midline, it is cylindrical in shape. 2/5 part away from the midline, it is flat in shape. That's why we have lateral 2/5 and medial 3/5. क्या इतना clear है सब लोगों को? Just give me a thumbs up in the chat box if this is clear to everyone. Let me put the charger. Meanwhile, you give your like. चलो खुशी. Yes. Ah, sure. We are very good. Very good. Very good, guys. अभी ना जब हम cylindrical बोलते हैं, अब तुम्हें दिख रहा होगा यहाँ पे भी. Let us just try to assume this picture again. You can very well see कि मिड लाइन से 3/5 की तरफ देखो, ये पूरा का पूरा सिलिंड्रिकल शेप है. वी हैव डिवाइडेड इनटू 3/5 एंड 2/5. तो ये 3/5 हिस्सा बिल्कुल क्या सिलिंड्रिकल शेप है, और बाकी का 1/5 क्या है, रेस्ट 1/5 इज फ्लैट इन शेप. रेस्ट 1/5 इज फ्लैट इन शेप, राइट? तो रिमेंबर गाइस, यस रिमेंबर. Now when we say medial 3/5 beta, now there are two things which is called surface and borders. Okay, we have surfaces and borders. Now beta, just try to see if the medial 3/5 is cylindrical in shape. Now, cylinder has equal areas on all the sides. चारों तरफ एरिया बराबर है, तो उसमें क्या हम बोलेंगे, surface. Okay. Now, what is the difference between surface and border? Now, when I say the area of India is too large, okay, and when I say the area of Pakistan is also large, but when I say Indian-Pakistan border, so basically we are referring to what? We are referring to a line, right? We are referring to a line. Indian-Pakistan border क्या एक line की तरह ही है. So what is the difference between? Yes, you should know area. Okay. In terms of area, we are dividing the surface and border. Surface and border. Surface and border. Surface has more area, and border is just like a line. Border is just like a line, right? तो बॉर्डर एक लाइन की तरह है, और सरफेस में एरिया क्या होता है, ज्यादा होता है. तो सिलेंडर में क्या कोई बॉर्डर दिख रहा है आपको? अगर ये बॉटल सिलेंडर की तरह, if this bottle is in the form of a cylinder, there are no borders, right? So we have equal areas on all the sides. We have equal areas on all the sides. So anything which comes up, it is said to be superior. In front, anterior. Below, we have inferior. And behind, we have posterior. So the medial 3/5 is cylindrical in shape. It has four surfaces because we have equal areas all over. We have superior surface, one which comes in front, anterior surface, one which comes below, inferior surface, and the one which comes behind, it is the posterior surface. I hope this is clear to everyone now. I hope this is clear to everyone. So if the shape is cylindrical, so remember it has, yes, it has four surfaces. Four surfaces, remember. And these four surfaces, please just try to mark it over here. Yes, 1, 2, 3, and 4. So we have, yes, superior surface. We have inferior surface. We have anterior surface. And we have posterior surface. We have posterior surface. So we have four surfaces, guys: superior, inferior, anterior, and posterior. Right? Now, guys, just try to see over here. Okay. Lateral to fifth, it is flat. It is flat like this cone. It is just like this lateral to fifth part. Now imagine we have maximum area on the top and the same area below. But in front, we have just like a line. It's a flat surface, right? So we have superior surface, we have inferior surface, we have anterior border. Anterior surface नहीं होगा क्योंकि बेटा anteriorly तो एक लाइन ही प्रेजेंट है. बॉर्डर और सरफेस में यही तो फर्क है. सरफेस में एरिया ज्यादा है. अब तो इसमें हम जो फ्लैट चीज है वी कैन इजीली डिस्टिंग्विश दैट द एरिया ऑन द टॉप इट इज लाइक मोर. So we have superior surface, inferior surface, anterior border, and posterior border, right? Because of its flat shape. Because of its flat shape, right? So you guys have to remember that we have, yes, we have two surfaces and two borders. Two surfaces, we have, yes, the superior surface and the inferior surface. Two borders, anterior border and posterior border. Anterior border and posterior border. Anterior border and posterior border. बेटा फटाफट से एक बार इमेज में देख लेते हैं. आई होप दिस इज क्लियर गाइस. अगर मैं मान के चल रहा हूं कि दिस इज, यस, दिस इज मीड, ओके, दिस इज मीडियल 3/5. ये पूरा का पूरा मीडियल 3/5 है. और ये क्या है? लेटरल 2/5. ये ऊपर वाली कौन सी है? सुपीरियर व्यू है. सुपीरियर व्यू है. तो अब मुझे पता है आप लोगों को ये कौन सा सरफेस होगा. सुपीरियर सरफेस, दिस वन विल बी द सुपीरियर सरफेस. पीछे की तरफ क्या हो जाएगा? पोस्टीरियर. आगे की तरफ एंटीरियर. और नीचे की तरफ नीचे वाला सरफेस कौन सा हो जाएगा? दिस विल बी द इंफीरियर सरफेस. लेटरल 2/5 की अगर बात की जाए, लेटरल 2/5 की अगर बात की जाए गाइस, दिस इज द सुपीरियर सरफेस. This is the inferior surface, right? अब आगे की तरफ ये कौन सा बॉर्डर होगा? देखो आगे लाइन लाइन की तरह एक, तो ये एंटीरियर बॉर्डर हो जाएगा और पीछे की तरफ क्या हो जाएगा? ये पोस्टीरियर बॉर्डर। पोस्टीरियर बॉर्डर, एंटीरियर बॉर्डर हो गया, पोस्टीरियर बॉर्डर हो गया, सुपीरियर सरफेस हो गया और इंफीरियर सरफेस हो गया। तो लेटरल टू फिफ्थ में वी हैव टू सरफेस, सुपीरियर और इंफीरियर सरफेस, दो बॉर्डर एंटीरियर और पोस्टीरियर, ठीक है। और सिलेंडर वाले में देखो सुपीरियर सरफेस है, इंफीरियर सरफेस है, एंटीरियर सरफेस है और पोस्टीरियर सरफेस है। आई होप दिस इज क्लियर टू एवरीवन गाइस, ऑल द पार्ट्स आर क्लियर। ये सारे पार्ट्स क्लियर हो गए हैं? just give me a thumbs up in the chat box if the parts are clear to each one of you. Shashi, very good, very good. Lukinder, Nikinder Reddy, very good, very good. Now guys comes the muscle attachment. Now guys comes the muscle attachment. Please try to write the muscle attachments with the help of red color. Yes, Abhi, Satvik, Sai Krishna, very good guys. Okay. Now superior surface, basically a muscle is attached. I'm talking about medial 3/5. We have sternocleidomastoid muscle. Sternocleidomastoid muscle. Please spelling this is this muscle. The examiner will touch this muscle in front of you and they will ask which muscle is this. In the neck, it is going to the clavicle. It's originating from the clavicle, the clavicular head. So which muscle is this, guys? Yes, this is the sternocleidomastoid muscle. Varshini, very good. Sterno coming from sternum, cleido muscle, clavicle going to the mastoid process. So sternocleidomastoid muscle. Inferior surface I'm talking about. Anterior surface, we have one muscle that is called as pectoralis major muscle. We have pectoralis major muscle. Again, make some sense. Beta, pectoral means anterior chest wall, right? So we have pectoralis major muscle, which is coming from sternum and also coming from the clavicle. Posterior surface contains sternohyoid muscle. Sternohyoid muscle. Sternohyoid muscle. Okay. So just try to look at this, guys. You already know I'm talking about. Okay, I'm talking about the medial 3/5, right? Medial 3/5 has four surface. The one which you can see over here, it is the superior surface, and on the entire superior surface, a muscle is attached that is called as sternocleidomastoid muscle. Mastoid muscle. Medial 3/5 का superior surface. मीडियल 3/5 का एंटीरियरली आगे की तरफ, आगे वाली सरफेस पर मसल होगी पेक्टोरालिस मेजर मसल. पेक्टोरालिस मेजर मसल. और पीछे, डोंट वरी गाइस, these muscles I will be taking separately also after the osteology gets completed, right? पीछे की तरफ we have another muscle, guys, right? We have on the posterior surface, it is sternohyoid. Sternohyoid muscle. Sternohyoid muscle. Right? Sternohyoid muscle. Right? Now we have to come to the inferior surface. Inferior surface. Now, if we talk about the medial 3/5, now beta, if you want to look at the inferior surface, now you have seen the superior surface, right? You have seen the anterior, you have seen the posterior. Now coming on to the inferior surface, guys. The inferior surface, if we just try to look at the inferior surface, over here I can't show you, but like this I will be able to show you. Remember that there is a groove which is present. एक गड्ढा देखने को मिलता है. There is a linear groove or linear sulcus that is called as the subclavian groove. नीचे की तरफ बिल्कुल mid of the shaft, inferiorly, medial 3/5, मीडियल 3/5 का नीचे वाला जो सरफेस है, वी हैव अ लीनियर ग्रूव, एक हल्का सा गड्ढा देखने को मिलता है, लीनियर गड्ढा देखने को मिलता है. Linear pit is shown, that is subclavian groove, that is subclavian groove. And guys, you can very well see this is the medial end, this is the medial end, right? This is the medial end, right? And towards the medial end, a rough impression is present. A rough impression is present. If we just want to look at this particular diagram, guys, can you see this is the inferior view, and we have medial 3/5, medial 3/5 now. And I hope everyone can appreciate this linear depression over here. This is the subclavian groove. This is the subclavian groove. And remember that, yes, this subclavian groove basically contains a muscle that is called as subclavius. It contains a muscle that is called as the subclavius muscle, right? It contains a muscle that is called as subclavius muscle. Whereas when we talk about this impression, it is a rough impression, guys. It is a rough impression. And why this rough impression is present? Guys, just try to look at this image right now. Just try to look at this image, and you guys will be able to see over here. Okay, so I will be deleting this just to make you understand what is, yes, the superior view. And you guys can very well see that this is the first rib, and this is what clavicle. This is what clavicle. ध्यान से देखो clavicle का जो नीचे वाला part है, the inferior part of the clavicle, it is touching what? The first rib. It is in contact with the first rib. First rib is also a bone, and clavicle is also a bone, right? Clavicle के नीचे से, just below the clavicle, what is passing the first rib? Okay. Now first rib is a bone, clavicle is also a bone. So basically these two bones are touching with each other. Okay, they are touching with each other, and they are forming, basically they are actually joined together with the help of a ligament, guys. And that ligament rib is also called as the costal rib. So that ligament is called as costoclavicular ligament. Okay, costo means the coastal rib, clavicle means the clavicle bone. बोथ द बोन देख लो, क्लैविकल के नीचे से रिब पास कर रही है, तो क्लैविकल के नीचे इसी मीडियल एंड की तरफ, नीचे की तरफ क्या होगा, एक रफ इंप्रेशन प्रेजेंट है जहां से लिगामेंट जुड़ी हुई है. दैट लिगामेंट, इट इज कनेक्टिंग क्लैविकल टू फर्स्ट रिब. ओके, so remember guys, yes, if you can see this rough impression over here, that is for costoclavicular ligament. Costoclavicular ligament. That is for costoclavicular ligament, right? So let us just try to see over here, guys. The inferior surface, guys, remember, the inferior surface, it presents with, there are two things in the inferior surface. One, we have the subclavian groove, subclavian groove, or subclavian groove may basically a muscle is attached, and that muscle, it is called as the subclavius muscle. Subclavius muscle, right? Apart from that, we have a rough impression. Remember? Yes, just try to, yeah. We have a rough impression for costoclavicular ligament. Costoclavicular ligament. We have a rough impression for costoclavicular ligament. We have a rough impression for costoclavicular ligament, right? So the medial end is completed in just a small flow chart. In just a small flow chart, all the medial end is completed. Coming on to the lateral 2/5, guys. Lateral 2/5. Please remember, guys, the anterior border. Okay, superior surface we have no attachment. कुछ भी attach नहीं होता lateral 2/5 में. Anterior border we have a muscle that is called as deltoid muscle. We have a muscle that is called as the deltoid muscle, right? The posterior border we have, yes, trapezius muscle. Trapezius muscle. Trapezius muscle. So we have deltoid muscle and trapezius muscle. Deltoid muscle and trapezius muscle. Just try to look over here, guys. Yes, we are talking about this lateral 2/5 और lateral 2/5 में ये जो superior surface है यहाँ पे कुछ भी attachment नहीं होती. Anteriorly जो border है, this is anterior border. Anterior border. And remember, guys, anterior border, basically what is attached over here? Deltoid muscle. Or posterior border, we have trapezius muscle. We have trapezius muscle. We have trapezius muscle, right? सुपीरियरली कुछ अटैचमेंट नहीं है. अब हम जाते हैं इंफीरियर सरफेस पे, इंफीरियर व्यू पे. इंफीरियर व्यू पे आपको ध्यान रखना है बेटा कि वी हैव लाइंस ओवर हियर. एक बिल्कुल एक सिंपल लाइन देखने को मिल रही है दैट इज कॉल्ड एज ट्रेपीजॉइड रिज. इसको हम लोग क्या बोलते हैं? ट्रेपीजॉइड रिज. और उसी के साथ हमें एक ट्यूबरकल देखने को मिलता है जिसको हम लोग बोलते हैं कोनॉइड ट्यूबरकल. बेटा ट्यूबरकल का मतलब होता है स्मॉल राउंडेड प्रोजेक्शन ऑफ द बोन. Tubercle means small rounded projection of the bone. Small rounded projection of the bone. ठीक है, तो एक राउंड जैसा प्रोजेक्शन, छोटा सा राउंड जैसा प्रोजेक्शन दिखेगा उसको बोलते हैं कोनॉइड ट्यूबरकल. और एक लाइन जैसी दिखेगी जिसको बोलते हैं ट्रेपीजॉइड रिच. ट्रेपीजॉइड रिच एंड कोनॉइड ट्यूबरकल. ट्रेपीजॉइड रिच एंड कोनॉइड ट्यूबरकल. Okay, so remember, guys, the inferior surface basically they contain, yes, we have trapezoid ridge, we have conoid tubercle. We have trapezoid ridge and conoid tubercle. Be very clear with this. Trapezoid ridge है और conoid tubercle है और दोनों पर ही एक ligament attach होती है. दोनों पर ही एक ligament attach होती है. And please all the ligaments in black color. This ligament it is called as coracoclavicular ligament. This ligament is called as coracoclavicular ligament. Coracoclavicular ligament. या मैं लाइव हूँ ना, अभी मैं लाइव बैठा हुआ हूँ यूट्यूब पे. अभी मत बोलो कुछ भी, मैं तुमसे थोड़ी देर में बात. Is this clear, everyone? I hope this is clear. Coracoclavicular ligament. एक ही पार्ट में, एक ही स्लाइड में सारे के सारे पार्ट्स हो गए. All the joints are done. All the ligaments are done. All the ligaments are done. Right? All the ligaments are done. If you can just see over here बेटा, देखो बेटा, ये कैपुला का पार्ट है जिसको बोलते हैं कोराकॉइड process of scapula. Coracoid process of scapula. Over here you guys can very well see कि ये जो है एक तो conoid tubercle है और एक trapezoid ridge है. तो दोनों से जो लिगामेंट आता है बेटा, इट इज जॉइनिंग विद द कोराकॉइड प्रोसेस ऑफ स्कैपुला. और ये क्या है? क्लेविकल है. तो इस लिगामेंट को हम लोग बोलते हैं कोराको क्लेविकुलर लिगामेंट. कोराको क्लेविकुलर लिगामेंट. कोरैको क्लेविकुलर लिगामेंट। देखो कोरैको मतलब कोराकोइड प्रोसेस बोन है, क्लेविकल भी बोन है, और क्लेविकल और कोराकोइड प्रोसेस को जोड़ने वाली लिगामेंट क्या है? कोरैको क्लेविकुलर लिगामेंट। कोरैको क्लेविकुलर लिगामेंट एक तो देखो कोराकोइड प्रोसेस को टच कर रही है, और एक टच कर रही है ट्रेपीजॉइड लाइन को, ट्रेपीजॉइड रिज को, और एक टच करी कॉनॉइड ट्यूबरकल को। तो इन दोनों से बेटा बेसिकली a ligament ही निकल रही है, and that is nothing but the coracoclavicular ligament. Coracoclavicular ligament. Is that clear, everyone? Is that clear, everyone? The parts of the clavicle. The parts of the clavicle. चलो ऐसा करते हैं, इसके बाद हम लोग कंटिन्यू करते हैं, इसके बाद हम लोग कंटिन्यू करते हैं कब? Tomorrow. Tomorrow at the same time or in the afternoon we will continue part 2, and I will complete the clavicle and scapula tomorrow. Okay, fine. The PPT will be available at my like Telegram channel, right? So yes, the PPT will be available at my Telegram channel. I'm just mentioning the name of my Telegram channel, that is Docs Mayan. Docs Mayan. It is my Telegram channel, Telegram. And for any inquiry, you can use the WhatsApp number, right? 85878 87291. Right? So you can, for PDFs, Docsman, WhatsApp, and Insta ID, guys. Yes, it is Abhijeet Kumar 7859. Abhijeet Kumar 7859. Right? So we'll continue the lecture tomorrow, guys. We have already discussed today the regions, the bones, or the bones of the hand, right? We have discussed the normal x-rays, some dislocation, fractures, the osteology. We have discussed the type, structure, anatomical position, functions, and the parts of the clavicle. The parts of the clavicle. Tomorrow I will be, covering the rest part. That is the muscle attachments, right? The peculiarities, the side determination, ossification, and clinical anatomy tomorrow. And then we'll start with scapula. Okay. Okay. Sure. Thank you so much, guys.